The images are heartbreaking. Thousands of Americans dead because of coronavirus. Many more are infected. Many more will be. What's even more horrific is that African Americans are dying from COVID-19 at rates much higher than other races. Joining me to talk about this disturbing reality, Dr. Joseph Gath Jr., an infectious disease specialist who spent much of his almost 40-year career dealing with the intricacies of some of the most perplexing diseases that we have been dealing with. So, Dr. Gath, thank you for being here this morning. It's mostly common knowledge that African Americans are disproportionately impacted when it comes to health issues. What, if anything, makes the impact of COVID-19 any different?
Well, what makes a difference is that while we represent only 12% of the population, with the COVID-19 epidemic, we now represent 33% of the hospitalizations. And what that translates to is people in the African-American community coming into the hospital, unfortunately, sicker, and that translates to an increased risk of death. For example, our neighbors in Louisiana, African Americans are 33% of the population, but 70% of the deaths from COVID-19. And so not only is it affecting our community by more infections, it's actually affecting our community with a disproportionate amount of illness and, unfortunately, people dying.
So let's talk about some of the answers potentially. You've stressed the importance of testing. Is there a connection between testing numbers or lack thereof and impact in the Black community?
There's no doubt about that. Unfortunately, African-American neighborhoods are less likely to get tested. And the bottom line is there's just two types of people now in our community. Ones that are infected or ones that are potentially going to be infected. The only way to know the difference is to get tested. And there is no excuse in the Houston community to not get tested. We have multiple free sites in Houston where testing can be done. It's an imperative that everyone in our community, but especially African Americans, because we're disproportionately affected, come to get tested so you'll know whether or not you're positive or not. If you're positive, it's important to connect into a healthcare person that essentially does COVID-19 for a living so you can make sure that you can get tested and potentially treated before you become ill.
Well, even with testing, how big of a factor are the, what we've often heard of, the underlying health issues in the Black community? How much is that influencing the negative outcomes we're seeing?
It's a much greater thing. African Americans are 30% more likely to have pre-existing conditions. We're unfortunately overrepresented in what I call high contact essential services, bus drivers, grocery store personnel, nurses, things like this. And so we're more adept in getting infected. And unfortunately, with the 30% increase in pre-existing conditions, this makes us more prone to have complications if we experience a COVID-19 infection.
So at this point, how big of a challenge is it for to make African Americans, like everyone else, believe in the social distancing mandates and also the need to get testing?
Well, the only way to combat COVID-19 is not to get it. The only way to not to get it, we must, as a community, do social distancing. Again, because we have these contact essential services, sometimes it's more difficult. We have high-density population centers where many people are living in single homes, often multi-generational living conditions. And so we're unfortunately having sometimes difficulty in social distancing. So we must social distance to decrease the incidence in our communities. And everyone in our community needs to be tested, because if there is a person in your household that's positive, we need to know, one, to not only get that person in their treatment, but to make sure we test others in the household to make sure that the disease is not spread so we can get to the treatment algorithms and treatment programs early.
How optimistic are you that we'll be able to conquer this and get it done in short order?
I'm confident if Houston and our community gets together and do what we need to do. We have the tools that are necessary to get ahead of this infection, but we don't have time to wait. We're already behind, if you will, but there's no reason we cannot try to catch up in the next few weeks. Social distancing. Everyone needs to get tested. It is free. You may have to stand in line for a bit, but our community and people in our community's life depends on knowing your status to not only decrease spread in our community, but to target treatment programs that can allow us to not die from this illness if we end up, unfortunately, getting exposed.
Dr. Gett, thank you for your time this morning. We'll look forward to you being successful in all you're doing, and we'll talk more on Houston Newsmakers Extra. That's our program for this week.